Hey guys, I'm really sorry that I haven't had a chance to update any sooner than this. It's just been a really overwhelming week ever since Thursday. A lot has gone on. I'm going to give you like the Cliff Notes version because we would be here for 20-30 minutes talking about everything that's gone on. You're probably wondering, if you're not on my Facebook, do you have a baby or do you have a bump still? I'm still pregnant. Today is July 2nd. I'm actually 37 weeks and celebrating the fact that I've made it full term. And if the baby were born now, we would have like no health concerns or whatever. She wouldn't need the NICU. And I'm just happy I've made it to this point. So, last time we talked, I'm sorry, I'm dealing with super bad indigestion again today. It's actually making me quite nauseous, so bear with me. Alright, last time we talked, I was saying that I was going to have a biophysical on Thursday. And if you're not sure what that is, it's basically a wellness ultrasound where they measure the fluid around the baby, they check her heart rate, see if she's doing any practice breathing, and just see her behavior in utero, what she's doing. That went well. NST scan lasted for a lot longer than it should have. They usually last for about 20-30 minutes. And what that is they see baby's movement and they check, they listen to her heart again and they see if you're contracting. I was contracting towards the end of the NST. I was contracting every 2 minutes like a woman in active labor. They brought the doctor in towards the end and found out I had made 0 progression. So, prodromal labor contractions. They were quite uncomfortable, to say the least. Friday, I had my OBGYN appointment, which went great. My blood pressure's great. Total weight gain up till this point is 12.6 pounds. So I did gain a total of 2.6 pounds in 1 week. So I'm starting to pack on the weight in the last part of the pregnancy. I only have 1.4 more pounds to go till I reach my pre-pregnancy weight. I did lose 14 pounds, although I am really grateful that I've done this well with my weight management, being 37 weeks pregnant and, not gaining a super ton of weight because I'm a fat girl and we don't need to gain any more weight than necessary. So I'm proud of myself. My belly is measuring at 39 weeks, so I'm a little bit concerned at that. I mean, because I am a bigger girl, they might not get the most appropriate measurement. I still have my B-shaped belly, which is annoying. I'm really sad that it didn't pop out, but yeah, I'm a little bit concerned because anytime they have measured the baby, like done a growth scan and whatnot, she has been measuring on the bigger side. So I'm going to request a growth scan at next week's appointment just so I can get an idea of what I'm up for. I don't like the idea of possibly delivering an 11-pound baby, but we'll see what happens. I know they can be off by a pound or 2, but it's kind of my peace of mind that I want one. Anyways, fast forward to Sunday. Yep. I was at the mall with a friend and we were walking around and I started having really intense contractions. Like I couldn't talk through them, which was new for me. I could hardly drag one foot in front of the other. Sometimes I would have to stop and do some deep breathing. Anyways, we ended up at the hospital. They hooked me up to the monitor and they also hooked me up to a heart monitor, which is not something they have done before. They've checked my pulse and whatnot and they've seen my heart rate before, but they haven't had me hooked up to a continuous heart monitor, which I'm grateful that the nurse decided to do this time around because she made a comment that my heart rate was super high. And I often question what they mean by super high because your heart is supposed to regularly beat between 60 and 80 beats per minute or somewhere in that vicinity anyways. And I've been told like if my heart rate gets like around 100 or 110, that's really high to them. No, we're talking like 160 beats per minute. And I had no idea. I didn't feel it. I wasn't lightheaded. I didn't have chest pain. It was just strange. So yeah, they had let this go on for like an hour and a half to 2 hours before they decided to order an ECG. And my heart rate did come down to about 130 beats per minute, but it wouldn't dip below that at all. They told me that if the ECG results showed anything but normal, that I would be taken in for an emergency C-section, because I had such a high heart rate for so long. They didn't give me any medication to make it go down. I tried the Valsalva maneuver. It's where you like sit up and push down as if you're having a bowel movement. None of that went away. But my contractions were so intense that it was causing the high heart rate, which is a little sucky and a little bit concerning for me, because I know that they're going to push for an epidural when I am in active labor, because they said that if this happens and I have an epidural, I would be more relaxed. But the thing is, I was relaxed. Like, even though I was in a ton of pain, I wasn't having any anxiety. I was just like, I was okay. I don't really know how else to describe that. Like, I wasn't freaking out, but the amount of pain my body was in was just like screwing with my heart rate. So I know that they're going to push for an epidural. Anyways, we'll see. We'll see how things go. Thankfully, the ECG results showed as normal, and I'm still pregnant, which I'm really grateful for, because that was my worst fear. Going into a C-section and having an unstable heart rate and worrying about God knows what happening to me when I'm lying there cut open on the operating table. So yeah, I had been there for, I'm going to guess, about 6.5 hours. And the whole 6.5 hours I was contracting like that. The doctor came in and said, she checked me and said that I have made very little progress. I maybe like effaced a little bit more, and I can't remember what she said. I was just like so fed up at that point. I was crying and going it. I couldn't deal with the fact that I was doing all of this. My body was in so much pain, and my cervix is doing nothing. Anyways, so because of that, they sent me home Sunday night. Well, going into like Monday morning at around 1:30 or 1 o'clock in the morning, I got woken up by contractions, and they were really intense. I was throwing up, hyperventilating, which I was trying to get under control, but it was like my body was taking over, and I was losing my mind, basically, losing my mind. It was to the point where I had to call my mom to come over and help me with pain management. It was effing brutal. It's really brutal. And my dad came too, and he's begging me to go to the hospital. And I'm like, there's no point, because I know this is prodromal labor. I know it in my heart, and they're just going to send me home. And I'm sick of seeing the four walls of the hospital room. I was so fed up. So I ended up they were here from like 2 a.m. till 4:30 or 5 in the morning, something like that. And I ended up taking Diclectin and passing out and finally getting some sleep. Yesterday being Monday, I had a great day. I was hardly contracting at all. Like, it's amazing how different, like, it's like day and night. I can go from contracting like a mad woman in active labor to having Braxton Hicks that don't really hurt. So yeah, that's where I've been. It's been pretty crazy. Now, the bad thing is that because of my heart acting up the way it did when I was having painful contractions, the doctor on call is going to talk to my OB about a possible induction at 39 weeks. That is the last thing in the world that I want, because I know most inductions lead to C-sections, and I do not want a C-section. However, if that's the way the baby has to be born for her to be healthy, so be it. I just want to avoid everything humanly possible. All right, I just don't. I want to do everything humanly possible to avoid a C-section, or to avoid an induction. So, now being at 37 weeks, I know they say, like, don't do induction until you're like 39, 40 weeks, but I have like 2 weeks to get things going, and I think they're going to try to talk me into an induction, and they probably wouldn't have to talk very hard, because all they would have to say is, for the safety of your child, and I would be like, okay, let's just do it. I've waited this long to have a healthy child. That's the words they would have to say, even if they were full of shit. Yeah, so the doctors are pushing very, very strongly for a vaginal birth, because they want what is going to make me most relaxed, which would be a vaginal birth and not a C-section. They don't want me to have any SVT episodes, obviously, and they're very, very supportive on a vaginal birth, which is the good thing. But, yeah, if you guys have any suggestions, I don't care how crazy it sounds. I heard one thing about boiling cinnamon sticks for 20 minutes and drinking the water. I have never heard of this before, but I'm going to give it a go. I don't see why not, unless, well, I'm going to research everything first, but if there's no, like, harmful side effects in the baby, I'm so doing it. Tell me all the induction methods that you know. I've been walking and things like that, but it doesn't seem to do much. But, of course, I'm going to keep it up. Yeah, just tell me all the induction methods you've heard of. I don't care if it's, like, the craziest thing you could tell me. Just tell me. And chances are I will give it a go, as long as it's safe for the baby. So, yeah, that's where I'm at now. But thumbs up for being 37 weeks, making it this far, when I was expected to only make it to 36 weeks. My cervix held on, so I'm happy about that. We can have a healthy baby without the worry of any health complications, like her having NICU time or lungs not being fully developed. But yeah, I would really like to avoid the medical induction and try the natural one. So leave comments below. Thumbs up for being 37 weeks. And I have all my appointments from this point on are on Thursdays, including biophysical and OBGYN. I'm just going to update the second I leave the hospital or the OBGYN's office, so I know it's done and over with. And yeah, so there won't be any confusion of did she have a baby or didn't she. So I will talk to you on Thursday, unless I have a baby before then. Okay, bye.